Knee pain after 60 has become so common that most people stop questioning it. It gets labeled as wear and tear, something that just comes with time. Years of walking, climbing stairs, working, carrying weight. Eventually, the knees give out. That's the story most people hear, and over time, they start to believe it. But when you look at what research actually shows, a different picture starts to emerge. In many cases, the knee itself is not the primary problem. The real issue often sits just above and just below the joint. The muscles that are supposed to support and stabilize the knee slowly weaken over time. Not all at once, but gradually. And when those muscles stop doing their job, the knee is forced to handle forces it was never meant to carry alone. Every step you take sends pressure through your knee. When your muscles are strong, they absorb and guide that force safely.
But when they are weak, that force goes straight into the joint. Over time, that creates irritation, inflammation, and pain. So the goal is not just to protect the knee, the goal is to rebuild the support system around it. The first movement is simple, but extremely effective. The sit to stand. Sit on the edge of a sturdy chair. Keep your feet flat on the ground about shoulder width apart. Cross your arms over your chest so you're not relying on your hands. From here, stand up slowly, using control rather than momentum. Then lower yourself back down, taking about 3 seconds to sit. This one movement activates your thighs, your glutes, and your core at the same time. Start with 10 repetitions. These are the main muscles that take pressure off your knees during daily activities. Start with 10 repetitions. If it feels too difficult, use your hands lightly at first, then reduce that support over time. Next is the standing calf raise. Stand behind a chair and hold it for balance. Slowly rise up onto your toes as high as you comfortably can. Hold at the top for 2 seconds, then lower yourself back down slowly. Do 15 repetitions. The calves may seem far from the knee, but they play a direct role in how force travels through your leg. Strong calves act like shock absorbers. When they are weak, more stress goes straight into the knee joint with every step. The third movement is the straight leg raise. Lie on your back. Bend one knee so that foot is flat on the floor. Keep the other leg straight. Slowly raise the straight leg until it reaches the height of the bent knee. Hold it there for about 3 seconds, then lower it back down. Do 10 repetitions on each side. This movement targets a very specific muscle, the one just above and slightly inside your kneecap. It's one of the first muscles to weaken when knee pain begins, and one of the most important to strengthen if you want to stabilize the joint. The fourth exercise is the side-lying leg raise. Lie on your side with your legs straight. Slowly raise the top leg to about a 45-degree angle. Hold it briefly, then lower it back down with control. Do 10 repetitions per side. This targets your hip abductors, the muscles that keep your knee aligned when you walk. When these muscles are weak, the knee tends to collapse inward slightly with each step, increasing stress on the joint over time. The final movement is the standing hip extension. Stand upright and hold the back of a chair. Shift your weight onto one leg, then slowly move the other leg straight back, keeping your knee straight and your movement controlled. Go only as far as feels comfortable. Do 10 repetitions per leg. This activates the glute muscles that stabilize your hips and protect your knees from twisting or rotational stress, something that often causes discomfort during walking or turning. None of these movements are complicated. Within the first week, you may start to feel subtle changes. A little more stability, a little less discomfort when standing or walking. By the end of 3 weeks, for many people, the difference becomes clear. Movements feel smoother. Pain becomes less constant. Confidence in your knees starts to come back. Because in many cases, the problem was never just the joint, it was the support system around it. And once you rebuild that, everything begins to change.